Hello and welcome back to the Student Artist Network. This is Ryan here. Just want to provide another video for you for this week about current issues surrounding pharmacy. And I hope this will provide you more insight into from the last video where I discussed about five misconceptions about a pharmacist. Let's bring some awareness to some current issues in the field and see how maybe you can relate to them or how you can make a change potentially in the future for the field of pharmacy. Let's go. Point number one. I think this is one of the most common issues surrounding pharmacy, or most visible one. It's pharmacy burnout. There is a significant burnout within field of pharmacy right now, and that's mainly found within community practice, where there are issues surrounding cutting hours, crunching amount of prescriptions or service provided, etc. And all these things have led to pharmacists or other pharmacy staff not being able to perform their job as well, first of all, due to the stress that was put on by the conditions, as well as them leading to them for quitting. So, again, there are reports out there saying there is shortages of pharmacists from major news sources. But, however, these the shortage of pharmacists is not because there's not enough pharmacists out there in the market. It's because that we don't have pharmacists want to practice in unsafe conditions, and that is the major point, and that is why I believe that there are a lot of pharmacists out there trying to advocate for better working conditions so they can practice pharmacy safely and ensuring patients have maintained their medications or maintain their safety of taking their medications. If you would like to learn more about pharmacy burnout, I have a clip right now showing you one of our videos talk about pharmacy burnout from a pharmacist in our Behind the Counters episode 4.
And like I said, I like the part where I actually help people, but I felt like I wasn't doing that a lot. And the further along I got in pharmacy school, like the more pharmacists I talked to,
Mm-hmm.
especially in the community setting, which I
Mm-hmm.
had a lot of rotations in, it started to seem like they felt the same way. Like they felt like they weren't really having the impact that they wanted to, or that they thought they were going to have whenever
Mm-hmm.
they were in school or
Mm-hmm.
earlier on in their careers
Yeah.
for some of the 40, 50-year-old pharmacists.
Yeah, I think that's definitely another relatable point
Mm-hmm.
where like it's when you talk to different pharmacists out there who especially practice in community settings,
Mm-hmm.
you can observe those. Maybe sometimes they're just there to like maybe okay they might be helping to patients with dealing with insurance
Mm-hmm.
or something like that, but maybe sometimes some pharmacists might want more clinical side of
Mm-hmm.
things like helping patients, like counseling patients how to use their medications,
Yeah.
or like doing things that may be helpful to them, like to their health and overall,
Right.
instead of maybe sometimes dealing with a bunch of PA calls and stuff.
Yeah, that's kind of. I mean, that is what I wanted to deal with, and
Mm-hmm.
that's what I thought I would be doing. Like, I
Mm-hmm.
really thought I would be doing a lot of counseling with patients
Yeah.
because that's what we're taught in pharmacy school is
Mm-hmm.
like counseling, all the counseling points, all the very intricate parts of clinical pharmacy. But then when you get into a retail, especially a chain retail job, the independent pharmacies I worked at, there's actually a lot more one-on-one
Mm-hmm.
contact. But when you get into the chain setting, especially the larger chains like CVS or Walgreens, that kind of gets taken out, and it's more like you need to meet these quotas. Like we
Yeah.
need to sell this much of this, and you need to get that done and stop wasting your time doing this
Yeah.
what they consider to be not profitable things, but
Mm-hmm.
things that pharmacists are taught to do. So we're kind of at a juxtaposition as pharmacists. And
If you would like to check out the whole video, the description is down below as well. Point number 2: compensation of pharmacy services. There is a trend where pharmacies are unable to claim reimbursement properly from pharmacy provided services. And this has caused a problem in sustaining healthcare programs or health programs provided by the pharmacy outside of just normal medication dispensing. Or even in some certain senses, independent pharmacies might lose money from filling a prescription, which ultimately lead to closure due to financial issues. Point number 3: medication accessibility and barriers. There is a very, very complex background in terms of why someone would not be able to obtain the medication, or someone maybe prefer not to take it, but there are existence of certain factors such as pharmacy deserts where there's an area there's a lack of pharmacy choices, or you might have heard about certain medications unavailable in most pharmacies, whether the medication is back ordered or it's just generally unavailable due to manufacturing not producing enough, or there is a shortage within the wholesaler to the pharmacy. There is also the factor of cost, where patient will be unable to afford their medications due to no insurance or insurance not covered, where they would need to pay out of pocket for the medications for certain common expensive medications such as insulin, um, such and other maybe more specialized medications where insurance just would not cover for that medication for that particular certain condition. And it is an unfortunate reality. There's also the role of pharmacy benefit managers and insurance companies, where again, medication might not be a formulary, there might be a prior authorization required, and maybe there's a foreseen as the constant battle between physician practice and the cost of medications. And what's best for the patient, maybe sometimes it's just difficult to fulfill. There's also the cost of pharma drug pricings, where pharmaceutical companies might have a very high price in terms of especially their brand new medications that just come on market or that just got FDA approved. Point number four, too many pharmacy schools and there's a decreasing amount of applicants for pharmacy schools. There is a lot of pharmacy schools out there, especially in the US, we have right now. And looking at the current job outlook, which I will discuss in the next point, is not looking too good for all the new grads out there. And there might be a shortage of jobs for pharmacists out there in the future, as it's happening actually right now. Um, there is also the problem of inability to expose the career opportunities to different pre-health students for them to pursue a career in pharmacy, and maybe some of them just not aware of the different options of pharmacy you can have to pursue a career in. There are, multiple different fields of pharmacy, as I mentioned in my previous videos, and some students might just not be exposed to them, just think pharmacists are just there to work in community settings to dispense pills. And this is why we want to clarify these misconceptions, and hopefully you'll be able to understand that there are a lot more options out there. Again, there is also the stigmatization of what a pharmacist is. Again, check out our last video if you want to learn more about it. Point number five, job outlook. You can go ahead and take a look at the most recent Labor Bureau statistics that I've linked below, as always show up there on the screen right now. And there is definitely a short growth in terms of the job outlook for pharmacists. And there's also a drastic decrease in retail pharmacists in terms of the job growth. And yes, despite big corp pharmacies are constantly hiring, uh, there is a problem as transitions of pharmacists to more clinical role, to leading to a lack of retail pharmacists out there, that might be happening sooner or later. In the near future, you might also see as much pharmacists running your usual company setting, but instead of more of a technicians or machine handling the jobs, and just have one or two certain pharmacists just to verify and making sure everything's correct. Now, this is our top five current issues in pharmacy. And, I just went through this very briefly, and there's much more details to it. And I hope that you'll be able to learn more clicking into some of the resources and descriptions down below. And you can just take a look yourself at what's currently going on in the realm of pharmacy and how you can maybe support our actions to make a better future for pharmacies and patients out there to access their medications safely, and to hopefully expand the roles of pharmacists out there to practice in more of a clinical setting, so that we will be able to use our degree more efficiently. And I hope you enjoyed this video. Click like and share if you enjoyed this video. Subscribe to our channel if you like our content, and see you next time. Bye bye.